I realize the counties are not ready to put in the application yet to the governor, but I thought in the spirit of transparency, if we could just talk about kind of where things are at and why some things might be harder than others.
Yes. So we were very supportive of the governor's 7 prerequisites that she laid out yesterday. I think it signals caution appropriately as we move into this next move, which is going to be very much a balancing act. We have a virus that still spreads easily from person to person. We don't have a cure. We don't have a vaccine. And I think we've had relatively few infections in our population, which means there are still a lot of people who are not immune to this virus and who could still get sick. And that includes people of all age groups, even though we know certainly people who are older and people who are more medically fragile are at higher risk of having serious disease. So the 7 areas that she laid out, some are by region, and some are by county, and some depend on health systems. And so I would say all of that is more complex for the Portland metro area because population density really does matter in terms of how quickly and easily a virus can spread.
So I know one of them, in fact, the first one is a percentage of flu-like symptoms at the emergency room, less than the historic average for this time of year. I think they're going at like 1.5%. Do you know where we're at currently then with that?
I don't have my finger on that pulse right now. I think the state sets up monitoring for influenza-like illness, and I believe they're going to stand that up as well to be looking for that as an indicator of COVID-19. So I think the counties will be depending on the state to be watching that, and then we'll be watching it in our own county as well.
Okay, and then I also know, and this might also be region-wide, a 14-day decline in COVID-19 admits if you've had at least 5 within the last 28 days. Do you have any idea where we're at on that?
Right, so that's decreasing hospitalization. And again, there's always a lag in data. So by the time a case gets confirmed and then confirmed as hospitalized, and then we're able to see a trend, that's going to be on our expert disease trackers to be looking for that trend to see a clear signal of a 2-week decline. So again, there's always a lag in doing that kind of data analysis, but we're gonna be watching that I would say even more closely than we have been.
But do you know, has that been happening for at least a week or 10 days or no days or?
For at the county level, I would have to ask my experts what it looks like at the county level, because we have a regional dashboard showing hospitalizations that's open to the public. I should have clicked on it briefly before we started talking, but no, I'd have to get back to you as far as when the clock has started on that 2-week decline.
Okay, but if there has not been a decline, like if there were 5 new cases yesterday or something, that would reset the clock before we can even apply, right?
Correct. And I think we'll be looking for a bit more detail from the state on what constitutes a decline. And if there are some bumps over 14 days, does that count? Does the clock restart anytime there's a plateau? So I think there are a lot of details yet to be worked out.
Okay. And then on the testing, I think this is a region-wide thing, but it's like 30 testers per 100,000 people per week.
Mm-hmm.
I think you've been really involved in sort of knowing the testing capacity, but I'll bet that the region can meet that now. What do you think?
I think we are close. We have struggled to get supply, so testing supplies that you need in a clinic, testing supplies that you need in a lab, and then people to do the test, plus personal protective equipment for those people. We have struggled to bring those things together in a way that makes testing readily available to the community. So most of our testing capacity still resides with our hospitals and health systems. So there's some coordination work there to make sure that the right people are able to access the test so that it can be used for its intended purpose, which is really tracking disease spread and disease patterns in our county and in our region.
Okay. And I'm glad you clarified that, because when I read it, I didn't think that meant that the county had to be able to do that. It's just that has to be available within that region.
Correct. It has to be available, but I'm getting at, so there's testing availability, and then there's using the test for the intended purpose behind using it as a tool for reopening, which is making sure that people who need it can get it and can get it easily. And so that testing is actually put to public health use, to understand the disease patterns and to give us a sense of where we need to be putting our efforts.
Okay. Okay. Thank you very much. And then, so that brings up one of the points that I sort of threw at you in the confusing part on the first one, which was, I think one of the requirements is testing in all congregate care facilities where there's been at least one positive, and that includes long-term care and county jails. So, I mean, one of the questions immediately I have, does that mean jail owned by the county or any jail in the county?
So I'm interpreting that as recognizing that those congregate settings we know are high risk for virus spread. So being able to not only find cases in those settings, but then quickly test contacts, which may end up being everybody, depending on the setting. That's going to be a challenge, even though in public health we recognize. I mean, that's what we do, is test people who've been exposed and at least have them do a symptom watch. So I think this one's also going to take some planning around, again, testing capacity and how we use it where we know we need it, which is in those settings where we know the virus can spread easily from person to person.
Okay, cool. Thank you very much. And then on the tracing, it's 15 per 100,000 people, which I'm no mathematician, but I think in Multnomah County, that means roughly 120 tracers. And when we've talked before, it seems like you guys are ramping up towards that.
We have been ramping up towards that. And I started to talk about this earlier because I think this is one where I'd like the chance to clarify that it's not just sort of grabbing people who can make phone calls. There's actually a skill and training that needs to happen for our contact tracers. Partly because most of contact tracing is really dependent on establishing a relationship with the person that you're talking to. This is all voluntary as far as we're concerned. We're asking people who are confirmed positive to stay home. We're asking them to share with us who they've been around so we can talk to those people and convince those people to stay home on a symptom watch for 14 days. So we have plans to scale up into the double digits fairly readily. The rest of the plans, though, to scale up further are for now on paper. And so this is going to be a big lift. We also need to make sure that these contact tracers speak different languages, are from different communities. Excuse me, again, because trust is really a key component of the contact tracing, along with the ability to support people to do the right thing. So if they need food, if they need, if they need help to stay out of work for the time that we're asking them to stay away from others, we need to be prepared to support them. So this one's really important. It's the work that we do every day, just on a much bigger scale.
And so I think that'll be surprising to people who are hoping, gosh, maybe we could open up next week or 2 weeks from now, but it sounds like it's quite a ways off.
Again, we're working on this, but we're being cautious, and we need to get this part right, because the last thing we want to do, well, there are a few things we don't want to see. We don't want to see the virus suddenly spread through our community and overwhelm the health systems in the way that we've worked so hard to avoid. We also don't want to get ourselves into a position of reopening and then seeing red flags and then having to take a step backwards. So we're doing this, understanding that some people feel a real urgency around this. Understanding that there's risks to everybody, but especially our most vulnerable populations, knowing that people want to get back to work, need to get back to work, and really trying to strike the right balance.
Any idea how long it'll take to get those 120 contact tracers?
I would say on the order of weeks at a minimum, and Multnomah County is planning on publishing a dashboard starting next week. We hope to have it up for the public to see. Here's the goal, here's where we are today. And so people can really clearly see what kind of progress we're making. Okay,
that's a great idea. And then finally, one of the requirements at the county level was for isolation housing, I guess, for folks that test positive. Where are we with that?
So this is another area that we're going to have to look at, but we've sort of blazed the trail in our response to our homeless community and getting them spread out into shelters that allowed for more physical distancing. and then also having motels where sick individuals could go for testing or until they were otherwise cleared to go back to the general shelter setting. So Multnomah County has experience now with this kind of housing model for people to go who are ill or who just need to be away from others. But it's something that we had not yet explored as a formal tool for our contact tracing efforts. But will be, again, it's on the list with lots of people working on it.
Okay, but it sounds like you're a little ahead of the game because you've at least identified locations that would be open to that.
Yeah, correct. We have some experience now in thinking about how those motels and places need to work, how they need to be staffed. So we already have some ideas and some experience in that area.
Okay, and just as a bonus question, are many people using the convention center?
I don't know what our census is at this moment. I can find that out for you.
I was just curious.
It's in the tens, just as far as order of magnitude. It's been in the tens of people.
Yeah. Okay. Cool. And then the final thing was the hospital surge capacity, which I bet we have more than 20% right now. So that seems like an easy one.
We do. So our health systems did just a phenomenal job preparing for a wave of illness that thankfully never came. So thank you again, Oregonians who abided by the governor's stay-at-home order. So we do have some extra room there. It's something that we are going to have to watch closely because, again, we are the most populous area of the state. We have the most hospitals in Multnomah County. And so with people coming in now to get caught up on their healthcare and their procedures, watching both hospital capacity regionally and the personal protective equipment supply, that's going to be a key piece. But again, we have great partnerships and we have systems that have been stood up in the last few weeks to monitor those things.
Okay, and then PPE was the last thing I was going to ask about. I'm also assuming the hospitals are good to go with that too, because they wouldn't have been able to restart the elective surgeries without it.
PPE, personal protective equipment, it's relative. So the hope was for supply chains to become reliable. The truth is, at least what I'm hearing, is that supply chains may never be truly reliable, and frankly, historically, have never always been reliable because our health systems are dependent on a global supply chain. And so a disaster in one part of the world can result in shortages here in Portland. So I think it's a question of keeping a close eye on supplies and working really closely with hospitals to make sure they're striking a balance between conserving what they have, but also being able to have fresh supplies and keep their workers protected.
Okay, cool. And then finally, because you're so brilliant and I know you have a crystal ball and you're always predicting the future, if you were to predict, I mean, is our region, because I know it's not only the county, but it's the region as well, are we a month away from being able to go to the governor, or are we 2 months away?
I think my sense is we are weeks away at a minimum is what I would say at this point. And it's really hard. It's really hard to say because, again, we're scaling up work that we do every day, but on a scale that we haven't worked on historically and on a timeline that is fairly aggressive. And again, we want to get it right. So I would say weeks is safe, and whether that weeks means a month or several months, I can't say at this point.
Okay, I respect your wordplay because I was going to follow up and say, well, okay, weeks. Does that mean like 10 weeks, 12 weeks, or 3 weeks? Initially, I was thinking you meant more like 3 weeks, but then you're giving yourself a back door as well.
I think it's at minimum 3 weeks, probably more like a minimum of 4 weeks, realistically. And we don't know what's going to happen between now and then. Again, a month in this pandemic, things can change dramatically. So I'm not sure what we'll be looking at in a month. We may be, again, learning from places that have reopened on a more aggressive timeline than we have. So we may need to adjust course. So I should do my usual caveats that this is all subject to change as we continue to learn about this virus and the way it behaves, depending on individual behaviors that add up collectively for the rest of us.
Okay, terrific. And I think that's really good to get out because it helps manage sort of the public expectation. And you've been, I think, doing a great job talking about how much work there actually is, just bringing on all these contact tracers. And I think that will sort of explain to people why it's not going to be fast or, a week.
Right, and I think, thank you, because that also gives me the chance to emphasize that, as we do more testing, case numbers will go up, and as people mix, the virus will find its way into somebody who gets really sick and may die. And so these are all trade-offs that we're looking at as we contemplate reopening. And again, we're trying really hard to get it right. I feel like the governor has set out a very reasonable roadmap, but Multnomah County and I think our regional partners are going to be working very hard and very carefully to get this next phase right, because it really is a balancing act.
Yeah. Okay. Well, thank you for sharing your insights and knowledge and
Sure.